The triceps brachia is a major muscle of the upper arm in the human body. The triceps run along the humerus, the main bone of the upper arm, between the shoulder and the elbow. Along with the biceps, it enables extension and retraction of the forearm. When the triceps are contracted, the forearm extends and the elbow straightens. If the triceps are relaxed and the biceps flex, the forearm retracts and the elbow bends. One of many weight room exercises for working out your triceps would be bench dips. Sit on side of a bench. Place hands on the edge of the bench. Position feet away from the bench. Straighten arms and slide the rear end off of the edge of the bench and rest heels on floor with legs straight. Lower body by bending arms until a slight stretch is felt in the chest or shoulder, or rear end touches floor. Raise body and repeat. The majority of movement during the dip exercise occurs at the elbow joints, making the triceps the primary movers. But because there is some movement at the shoulder joints, other muscles assist in the exercise, including the front shoulders and the chest muscles. Bones that move during this particular exercise is the radius, ulna, and humerus. The biceps brachia, commonly known as the biceps, is a two-headed muscle that lies on the upper arm between the shoulder and the elbow. Its main function is at the latter, where it flexes the forearm at the elbow and supinates the forearm. A weight room exercise that works out the biceps are bicep curls. Position 2 dumbbells to sides, palms facing in, arms straight. With elbows to sides, raise one dumbbell and rotate forearm until forearm is vertical and palm faces shoulder. Lower to original position and repeat with opposite arm. Continue to alternate between sides. The major bones that move during this exercise is again the radius, ulna, and humerus.
Oh crap, I should have pointed.
The deltoid muscle is the muscle forming the rounded contour of the shoulder. The deltoid is the prime mover of arm abduction along the frontal plane. The arm must be immediately rotated for the deltoid to have maximum effect. This makes the deltoid an antagonist muscle of the pectoralis major and latissimus dorsi during arm abduction. A weight room exercise for the deltoid would be dumbbell lateral raise. Grasp dumbbells in front of thighs with elbows slightly bent. Bend over slightly with hips and knees bent slightly. Raise upper arms to sides until elbows are shoulder height. Maintain elbows height above or equal to wrists. Lower and repeat. While in elevation, the scapula and clavicle bones move to perform this exercise.
Along with the soleus muscle, it forms half of the calf muscle. Its function is plantar flexing the foot at the ankle joint and flexing the leg at the knee joint. Some muscles that assist during the flexion and extension of the gastrocnemius muscle is the tibia and fibula. Stand in a shoulder-width stance with your toes flat on the edge of a box or a step, with your heels and midfoot hanging off the edge so you feel a stretch in your calf. Use the wall or a rail to support you to stay balanced. This is your starting position. Push your toes into the box so your heels raise up. Pause, then lower yourself back to the starting position, being sure to feel a stretch in your calf. External rotation and extension of the hip joint supports the extended knee through the iliotibial tract, chief, anti-gravity muscle, and sitting and abducting of the hip. Some bones that assist during the flexion and extension of the gluteus maximus is the femur. Cup the head of a dumbbell in both hands and hold it vertically in front of your chest, elbows pointing down. Step back with your right leg and lower your body until your front knee is at a 90-degree angle. Pause, and then push your body back up to standing position. Repeat on the other side. Moving the arms can also influence the movement of the scapula, such as the downward rotation during a pull-up. Some bones that assist and during the flexion and extension of the latissimus dorsi is the floor of the intertubular groove of the humerus. Choke the band around the center of the pull bar. You can use different bands to provide various levels of assistance. Pull the end of the bar down and place one bent knee in the loop, assuring that it won't slip. Take a medium-wide grip on the bar. This will be your starting position. Pull yourself upwards by contracting the lats as you flex the elbows. The elbows should be driven to your side. Pull to the front, attempting to get your chin over the bar. Avoid swinging or jerking movements. After a brief pause, return to the starting position.
The adductor muscles of the hips are a group of muscles of the thigh. The adductor's main function is to adduct or separate your legs away from the midline of the body. An exercise to work out your adductor muscles to train to help you get faster and get your adductor stronger are a thigh adductor machine. Since I do not have that particular machine in my house, I decided to use this instead. But let's pretend this is an adductor machine. To begin, sit down on the adductor machine and select a weight you are comfortable with. When your legs are positioned properly, grip the handles on each side. Your entire upper body, from the waist up, should be stationary. This is the starting position. Slowly press against the machine with your legs to move them away from each other while exhaling. Feel the contraction for a second and begin to move your legs back to the starting position while breathing in. Note, remember to keep your upper body stationary to prevent any injuries from occurring. Repeat for the recommended amount of repetitions. The major bones that move particularly for this exercise are the femur, sacrum, and ischium.
The trapezius. Upper fibers elevate and upwardly rotate the scapula and extend the neck. Middle fibers adduct the scapula. Lower fibers depress and help upper fibers upwardly rotate the scapula. An exercise for the trapezius is the dumbbell shrug. And I will now demonstrate the dumbbell shrug. So the bones that are moving while doing the dumbbell shrug is the scapula, because that's the shoulder blade, and it is moving when you are shrugging.
The external oblique muscle is one of the outermost abdominal muscles, extending from the lower half of the ribs around and down to the pelvis. Its lower parts connect to the top and the corner of the pelvis. Some bones that assist during the flexion and extension of the external oblique is the iliac crest, the pubic tuber, and the linea alba. Sit on an exercise mat with your knees bent and your feet flat on the floor. Lean your torso back to about a 45-degree angle and lift your feet up off the mat so your lower legs are level to the floor. Extend your arms out in front of you, palms pressed together. As you inhale, rotate your torso to the right. Pause for a moment, then exhale and rotate back through the center. Inhale as you rotate to the left, then exhale back to the center. Repeat this for 10 to 12 reps on each side.
The pectoralis major. The clavicular head flexes the arm at the shoulder joint. The sternal head extends the arm at the shoulder joint from a flexed position. Both heads working together medially rotate the arm at the shoulder joint and adduct the arm at the shoulder joint. An exercise for this, for the pectoralis major, is the bench press. I will now demonstrate the bench press. The bones that are moving during the bench press are the radius, the ulna, the humerus, and the scapula. Okay. The vastus intermedius, the vastus medialis, and the vastus lateralis extends the leg at the knee. The exercise for this is leg extensions. And I'll do the leg extensions. the bones that are moving during this exercise are the tibia, the fibula, and the patella. The semimembranous, the semitendinosus, and the biceps femoris extends thigh at hip. It also flexes leg at knee and laterally rotates leg if knee is flexed. An exercise for this is a leg curl. I'll do a leg curl. If I have to. The bones that are moving during this exercise are the tibia, the fibula,